Assalamu alaikum. On behalf of Ahsan Academy, let me welcome you to a presentation on neck mask. Let us fix the objective. We'll discuss here the compartments of the neck, the distribution of the muscles in the neck, description of each muscles present here in the neck, and the formation of the triangles by the muscles. If we see the section of the neck, we can find the distribution of the muscles. The outermost layer, that is under the skin, the superficial muscle, contains a muscle named platysma. It is in the anterior and lateral part of the neck. Deep to this lie the investing layer of the deep fascia, and the investing layer splits to enclose the sternocleidomastoid muscle shown anteriorly. Just behind that, the infrahyoid muscles, and lastly behind the trapezius muscles. Deep to that lies the prevertebral layer of deep fascia, and it includes the muscles around the vertebra. The platysma is a flat muscle present in the superficial fascia. It begins in the superficial fascia of the thorax below and moves up and remain attached to the mandible, base of the mandible, and goes further to be distributed in the face. It blends with the deep fascia and the muscles of the face. It is supplied by the facial nerve. Specifically, the cervical branch of the facial nerve supplies this muscle. It is observable that this muscle is attached to the mandible only as the bony attachment. Below, it blends with the fascia of the thorax and lower part of the neck, and above with the deep fascia as well as the muscles of the face. This muscle depresses the mandible when contracts the muscle below the mandibular attachment, and whenever the part of the muscle above the attachment of the mandible contracts, it makes a wrinkle in the skin of the face. The next muscle is sternocleidomastoid. The very name has three components. Sterno means sternum, cleido means clavicle, and mastoid means mastoid process of the temporal bone. So these three attaching bone together contributes in the name of the muscle. This is the mastoid process of the temporal bone, and this one is the medial part of the clavicle, and this head is attached to the manubrium sterni. So this is attached above to the mastoid process, and this is the lateral part of the mastoid process, and posteriorly it continues into the lateral half of the superior nuchal line. Below, it has two heads, and the fibers from the anterior part crosses the midline, mid part of the muscle from behind, and attaches to the medial part of the clavicle on its superior surface. The posterior part of the muscle remains superficial, and it crosses the deeper belly and is attached to the front of the upper part of manubrium sterni. That's why this muscle is also considered as cruciate type of muscle. This is the mandibular head, and this one is the clavicular head of the sternocleidomastoid. Sternocleidomastoid receives nerve supply. The motor component reaches there through the spinal part of the accessory nerve, and the sensory part receives from the cervical second and third spinal nerve ventral rami. When the muscle contracts on one side, that is unilateral contraction is there, the head is tilted to the same side, towards the same shoulder, same side shoulder, and the head is, you can see the arrow, the simultaneously the head is rotated, and rotated face looks up and to the opposite side. When the muscle contracts bilaterally, means both the muscles contract together, it draws the head forward. This is observed when a weightlifter lifts the weight. We can see also in a person suffering from acute respiratory problem, they elevates the thoracic case, upper ribs during deep breathing, deep inspiration. Occipital muscle remains attached a long line, vertical line in the midline. It extends from the occipital bone, follow the nuchal ligament, then spinous process of the 7th cervical to all the thoracic spine, means up to 12 thoracic spine. This is the occipital bone, external occipital protuberance. This line up to the 7th cervical spine is the nuchal ligament, and from this you can see the total all spine of the thoracic vertebral tips provides attachment to this trapezius muscle. Then it is inserted into a line, you can see on the right figure, this is the scapular spine, then anteriorly the acromion, then lateral part of the clavicle. The trapezius muscle is supplied by the motor portion from the spinal part of the accessory nerve and the sensory portion from cervical 3rd to 4th spinal nerve ventral rami. Trapezius has control over the scapula, and it stabilizes the scapula on the thoracic wall. It rotates the scapula. So on unilateral contraction, it tilts the head to the same side and rotates it to the opposite side, called the medial rotation. When it contracts bilaterally, raises the shoulder up. When spinal accessory nerve is injured, there will be paralysis of the trapezius muscle. When we inspect the person from the back, we will observe that the shoulder tips are not in parallel line, is not in horizontal line, it is dropped. This is known as shoulder drop. There will be loss of shoulder abduction, will be pain between the upper part of the scapula and winging. Winging is mostly observed with the paralysis of the serratus anterior muscle, but to some extent medial border is winged up because of the paralysis of trapezius muscle. Torticollis is a clinical condition. The other names of this condition is Vardy neck or twisted neck. This is a condition, a clinical state of the muscle that causes the head to tilt down. Here there is excessive contraction of sternocleidomastoid muscle alone or together with the trapezius muscle. You can see the figure, the baby born with the torticollis head, and it is because of the shortening of the sternocleidomastoid muscle. let me discuss the deep muscles. I will not go in detail of this deep muscle. We can classify this as per their position related to the hyoid bone. The muscles above the hyoid bone and below the hyoid bone. So below the hyoid bone, the muscles are known as infrahyoid muscle. The name indicates the distribution of the muscles, extension from bone to bone or cartilage to bone. So sternothyroid muscle, sternum to thyroid cartilage. Sternohyoid muscle, going from sternum to hyoid bone. Thyrohyoid, it is going from thyroid cartilage to hyoid bone. Omohyoid, this is a relatively longer muscle extending from the hyoid bone below to the scapula. The arrow showed the respective muscles one by one. Suprahyoid muscles means muscles that remain above the hyoid bone. Those are the digastric muscle, stylohyoid muscle, mylohyoid muscle, and genihyoid muscle as shown by the arrow. Digastric muscles are two bellies are shown by the white arrows. The prevertebral muscles actually lies around the cervical vertebra. They are deeply situated and covered by the deep layer of the cervical fascia. This includes the longus colli muscle that is remaining in front of the vertebra, and relatively shorter anterior vertebral muscle is the longus capitis. This is superiorly situated. These are actually the prevertebral muscle that lies in front of the cervical vertebra. Then we see the figure is showing the anterior, medius and posterior scalene muscles. And you can see the deep cervical muscles lying behind the vertebra on either side of the spine. These are actually part of the group of muscle known as erector spinae muscle. Let us discuss the scalene muscles attachment. The scalene muscles are three types. Anterior scalenus, this is attached to the transverse processes of cervical 3 to 5 or may extend up to the 6, and the middle, this is the scalenus medius, attached to the transverse process of the upper 6 cervical vertebra, and the posterior one is attached to the lower 6 cervical vertebra. They are inserted to the ribs. The first rib superior surface gives attachment to the anterior scalenus muscle to the scalene tubercle, and the relatively posterior part, just behind it, the subclavian arterial groove is there, and behind the groove the scalenus medius is attached. The scalenus posterior is attached to the second rib upper surface. This is having two separate attachments. Scalene muscles, they elevate the first rib and the second rib. The actually posterior scalenus muscle is attached to the second, other two to the first rib. So the first one, the anterior and medius, can elevate the first rib and thereby the other ribs. The second rib is elevated by the scalenus posterior, and thereby other ribs are also elevated. Keeping the lower part fixed, this can flex the head laterally and can rotate the cervical part of the vertebral column. One important structure that covers the cervical pleura, actually the apex of the lung projects into the lower part of the neck, which is covered by pleura known as cervical pleura. This cervical pleura again covered by relatively tougher fascial suprapleural membrane. You can see in the diagram the suprapleural membrane. This is extending from the inner border of the first rib to the transverse process of the seventh cervical vertebra. This is a very strong fascia. To this, a small part of the muscle extends from the cervical 7 transverse process and it fuses with this fascia. This is also known as scalenus minimus. This fascia is sometimes considered as the aponeurosis of scalenus minimus. So this scalenus minimus can tense this suprapleural membrane and thereby protect the cervical pleura and the part of the apex of the lung that is covered by the cervical pleura. So suprapleural membrane is sometimes considered as the tendon of scalenus medius. This is the neck, you can see, and you can see the arrangement of the muscle. So this particular arrangement of the muscle has given the opportunity to divide the neck into several triangular areas. The sternocleidomastoid obliquely runs and divides the neck into its anterior triangle and the posterior triangle. In the anterior triangle, there are two bellies of the digastric, anterior belly and the posterior belly. Also, there are two bellies of omohyoid, superior and inferior bellies. These muscles has divided the anterior triangle into several triangles and the posterior triangle into two triangles. This is the hyoid bone, you can see by the label. This portion is anterior triangle and this is the posterior triangle. So this anterior triangle is transmitting the structures that's running from the head to the thorax, and the posterior triangle above the clavicle is allowing the structures that passing from the upper limbs to the neck and thorax and vice versa. Let us see the different types of triangles in the neck. You see the anterior triangle is bounded by a blue line on the left figure, and the posterior triangle is shown by the green outline. Again, the anterior triangle division is shown by the different muscles, the digastric and omohyoid muscles. The digastric triangle is shown by the labeling 1, carotid triangle by the 2, muscular triangle by 3, and submental triangle by the arrow. Posterior triangle is divided into occipital triangle and the supraclavicular triangle respectively by labeling 8, 4, and 5. Let us see the digastric triangle. It is also known as submandibular triangle, and it is bounded by, you can see the triangular line with shaded area is the digastric triangle, and it is bounded superiorly by the base of the mandible and two bellies of the digastric muscles and the stylohyoid muscle. So anterior belly makes the anterior inferior boundary, and posterior inferior boundary is found by the two muscles, posterior belly of the digastric and stylohyoid muscles. The floor you can see is formed by the mylohyoid muscle and the hyoglossus muscle. This is the mylohyoid and this is the hyoglossus muscle in the floor of the digastric triangle. You can see in the figure that the digastric triangle is mostly occupied by the submandibular gland. On its surface, there are some lymph nodes, and in the lower figure, you can see that the facial vessels running across the face and has entered into the submandibular area. This is the digastric triangle. Mylohyoid arteries and nerves also present in this area, and you can see in the figure the lower part of the parotid gland has projected into this digastric triangle. Content of the carotid sheath in the upper part and the glossopharyngeal nerves remains behind the muscle making the posterior inferior boundary. The carotid triangle. The carotid triangle is bounded by the anterior border of the sternocleidomastoid, which is the posterior inferior boundary, and anterior inferiorly the superior belly of omohyoid is present. The superiorly it is bounded by the stylohyoid muscles and the posterior belly of the digastric. So this area is shown by the shading and the line on the left side of the figure. The floor is formed by the inferior and the middle pharyngeal constrictor muscles. This triangle contains some important structures, especially important for the clinicians. The common carotid artery with its bifurcation, the internal jugular vein, glossopharyngeal, vagus, and hypoglossal nerves. Carotid triangle is a significant area for the clinicians. The hyoid bone can be easily identified in the midline, and if we follow that with our index finger laterally, this will guide the index finger to the carotid triangle. You see, we can pulsate the internal carotid artery or common carotid artery. This index finger is showing the hyoid bone, and if we follow the hyoid bone, then we'll get the carotid triangle and we'll get the internal carotid artery there. If we follow the upper border of the thyroid cartilage, we'll get the bifurcation of the common carotid artery into internal and external carotid artery. You can see here that the terminal part of the internal carotid artery as well as the beginning of the internal carotid artery is dilated. This is carotid sinus. This area is very significant area. So if we want to pulsate the common carotid artery, that we should check it below the level of the upper border of the thyroid cartilage, and if we are interested for the common carotid artery, that should be the middle part of the carotid triangle. These are the photographs showing the way of getting pulsation of the common carotid in the lower figure and the internal carotid in the upper figure. You can see in the figure the mid part of the mid anterior part of the neck is the muscular triangle. It is below the hyoid bone and above the jugular notch. You can see the border, the inferolateral border is formed by the inner border of the sternocleidomastoid. The superolateral border is formed the outer border of the superior belly of the omohyoid muscle, and if we draw a line from the midpoint of the hyoid bone to the jugular notch, this is the muscular triangle of the left side. You can see it is not actually triangular, it is quadrangular. The upper small border is formed by the hyoid bone. This triangle has floor on the lateral part. This is the superior belly of the omohyoid muscle, and then you get the sternohyoid muscle, Then deep to this lies the sternothyroid muscle, and above this is the thyrohyoid muscle. You can see this triangle contains some lymph nodes. Submental triangle. Below the chin, this triangle is situated, and the apex is formed by the chin. The base is the hyoid bone, and on either side, the anterior belly of the digastrics is the medial border of that muscle, forming the submental triangle. The floor is formed by the mylohyoid muscle, and the median raphe of this muscle is in the midline. The figure you can see is clear. Posterior triangle you can see in the figure, it is above the mid third of the clavicle, and the anterior superior boundary is formed by the sternocleidomastoid, and the posterior boundary is formed by the trapezius, and the mid and above at the occipital bone. This triangle is divided into two parts by the inferior belly of the omohyoid muscle, and the part above the inferior belly of omohyoid is occipital triangle, and the triangle below is known as supraclavicular triangle. This triangle, the floor is covered by the deep fascia, investing layer of the deep fascia. This investing layer covers the floor, and under that floor deep fascia lies three scalene muscles, the anterior medius and the posterior scalene muscles, levator scapulae, and the semispinalis capitis lies in the upper part of the floor. This triangle contains, you can see in the figure, this is the area bounded by the line and shown by the dotted line. This nerve is the accessory nerve. This is an important content of this triangle. In addition to this, you can see on the left figure, the branches of the cervical plexus are distributed. In addition to that, you'll get the cervical lymph nodes, both superficial and also deep lymph nodes are there. Occipital artery lies at the upper part of the triangle. Supraclavicular triangle is just above the mid part of the clavicle, and this is below the inferior belly of the omohyoid muscle. So this area is on the surface, looks like a depressed area, so it is known as supraclavicular fossa. The other name is subclavian triangle because the important structures in this area actually lies behind and below the clavicular area. Its contents are especially important. You can see here in this figure, this is the inferior belly of the omohyoid muscle, and external jugular vein that runs inferiorly to open into the subclavian vein, and behind the subclavian vein, deep to the subclavian vein lies the subclavian artery. So this part of the subclavian vessels lies in this triangle, and it is clinically important vein to give direct injection to the heart. You see, this is the sternocleidomastoid, and behind that, and in the lower part, the trunks of the brachial plexus exits and enters into the posterior triangle. This becomes visible, palpable under the skin in the supraclavicular triangle. That's why these back trunks are especially important for the anesthesiologist. They use this area to block the nerve of the upper limb. You can see the figure. In the figure, there is heart and its great vessels. There is formation of the brachiocephalus of either side and formation of the superior vena cava. The brachiocephalic veins are formed by the internal jugular vein and the subclavian vein behind the sternoclavicular joint. So now the figure is showing the point near the apex of the heart, and you can see the angle between the clavicle and the muscle, sternocleidomastoid muscle. So this angle is actually indicating the position of that triangle I have just discussed, supraclavicular triangle or subclavicular triangle or supraclavicular fossa, anything you can say. This is the area where the doctor should insert the needle, and the needle should be directed in the direction of that line I have said just a few seconds back, and the needle can be placed in the great vein, and if the injection is pushed, then chemicals will immediately enter into the heart. So this is sometimes become life-saving area. Thank you very much for remaining with the video.